This triage procedure should occur in conjunction with normal first responder checks for ABCs, spinal, and other secondary injuries. This repackaging procedure should only be attempted in a protected environment and normally would occur if transport to hospital would last longer than about 30 minutes. In this case, we have our Coast Guard rescue personnel delivering the patient to the paramedics. Gently putting her down, nicely keeping her horizontal all the time. Thank you, gentlemen. So the patient has clearly been wet, and the first thing you want to do is try and do some triage to see what level. We know the hit from history that she is just cold, and we want to know what depth she is in our. Hello, can you speak? Hello. You can tell that she's not shivering, and she's not responsive to anything. Once in a while she is making some noises, so she is probably moderately to severely hypothermic, in which case we have to cut everything off. We do not try to take off the life jacket or any of her clothing. We're going to cut everything off. But because she is generally unresponsive and not shivering, we need to consider that she is moderately hypothermic, and we have to be very, very gentle in this case. Again, when drying off the patient, you do not want to rub or pat the skin in any way. You want to just place a towel on the skin and blot gradually as you move up and down the limbs or the torso. Blot the water off of the skin. And again, using their standard procedure, they're going to do a two-man carry to try and keep her horizontal as much as possible, be as gentle as possible. Place her on a dry sleeping bag, which will provide insulation during the trip to the hospital in the ambulance. Under normal conditions, all of the clothing would be cut off. In this case, we have no external source of heat, but we're going to rely on the fact that she's dry and well insulated, that her condition will not decrease anymore, and they'll just continue to be gentle and take her to the hospital as quickly as they can.